hey guys, how y'all doing? Hope you guys are good. Welcome to yet another episode of Sip and Learn. And today we will be joined by Dr. Dineo, who is a certified and qualified doctor. And we'll be talking all things sex education this afternoon. As you know that it's February, it is the month of love. So there are definitely things afisukusifundisa zona, as she is a qualified doctor. So in case you have any questions, you know what to do. You can always drop them on the comment section. Udokotela will be here to answer all of them. Right, just to give you a background of what we're going to be talking about this afternoon. Right, so we'll be talking about unintended pregnancy. All right, she is in the building. Right, let me accept the request. Conversation, you know what to do. You can drop your comment on the comment section. Yeah, so guys and girls, ladies and gents, kindly help me welcome the gifted doctor in the building. How are you?
Yappy, Lujanwin.
Yeah, Pila, looking gorgeous as always.
Are you sure?
100%.
Thanks. Thank you.
Natural
You
beauty,
look
honey.
lovely. You look like,
Thank
I don't know,
you.
we are happy, but anyway.
Bekumele ngimisele ngizokhuluma nawe. Right, for my people that just joined in, abafisa ukwazi ukuthi uba Dr. Dineo and what is she all about? Take it away.
Yeah, so thank you so much for having me, Miss B. I am
You're welcome.
Dineo Chitambo. I go by the gifted doctor. Yeah, just because I believe being a doctor is a gift, but also I believe there's so much more that every one of us has to offer the world, and that's really our gift. So yeah, that's my mandate, to just remind
Absolutely.
everyone of that and hopefully be the example of that. So today I look forward to really just giving off the gift of being a doctor by talking about sex education. Yeah.
Thank you. Thank you so much for your time. Ngiyazi ukuthi umuntu omatasatasa. Surely umusuka la, you've got another appointment. So thank you so much.
Unfortunately.
Right, so in case guys and Banama questions or anything of that sort, her page is right here, the gifted doctor. You can always drop her a DM. If you want to engage on the conversation, drop a comment on the comment section. Right, so we are talking about sex education because obviously February is the month of love. Now, let's delve into our topic, right? Because it's, you know, it's the month of love, they can get a little carried away, you know, after a date night, thinking that's about to what is actually the next move from here.
Yeah.
So let's talk a little bit about consent when it comes to, you know, agreeing to engage on sex, and what that looks like and why is it so important.
Yeah. So this is a little bit of a tough one, and I don't even think Hukuti in today's day and age it even happens. I don't even think consent is a thing, or people even know it exists.
Yeah.
Because it's so important, even amongst people who are partners or married. Every single time before a sexual encounter, there should be some sort of consent.
Yeah.
And obviously, the first way to see or to elicit ukuthi umuntu, um, are they also in the same space as you? Obviously, you need to see that sort of connection or agreement or the enthusiasm,
Yeah.
right? But masicabanga of maybe a way to remember it, or some or other way that really is a solid way of just thinking about consent. Singacabanga ama-fries, lawa waka
Yeah.
McDonald's. Yeah.
Right.
We can
Yeah.
we can just remember it by that. So the first one is it should be free. Like nobody should have to manipulate you. Ukuthi mhlawumbe I took you out on a date, so now you owe me sex.
Yeah.
It should definitely be coming from you. Ukuthi, no, I also feel the same way, and yeah, we're good to go. The next thing is
Sure.
it's reversible, so you can maybe mhlawumbe agree to have to having sex earlier, or maybe you could think, who would say, oh, okay, I think I'm ready. But then halfway through, you're just like,
You change your
I don't
mind.
feel like I'm making the
Yeah.
right decision. So you can change your mind. And at any given point, should you change your mind, the next person should be able to respect that decision. So that is consent. Should you change your mind and reverse your decision, that should still be valid. Then it should also be informed. What's okay, you say we're going to the bedroom or we're going to your place. What are we going to do? You know?
Yeah.
Or for me, maybe sex for me looks different from
Yeah.
you. Like I think of sex as, I don't know, maybe touching or, whatever. You think of sex as penetrative. So it's really important to you tell me, what exactly are we going to do? And secondly, inform me of anything that I need to be aware of. Are there any STIs? Are you HIV positive or negative? Anything else that possibly could be relevant, Um, and then, like I said, enthusiasm is quite important. And also, it must be specific. So, this is quite similar to being informed. Uguti, okay, what exactly are we going to do? And it's very specific. It's not just like, okay, we're going to the bedroom, we're just going to see what happens. No. Are we only going to be kissing? Are we only going to be touching? Are we going to be, what are we going to do? So very specific so that when I get to the room, I know what's expected of me and what I'm going to be getting in return. So, yeah.
Thank you for that. Fries. Okay, just to make sure that I understood you. So F is for free, R reversible, I informed, E enthusiastic, and S specific. Love that.
Absolutely.
Thank you, Dan. All right. So now let's talk about now that you feel you are ready to engage with that person, right? So talk to us about safe sex, especially with someone whom it may be the first time engaging in the sexual intercourse.
Yeah. So I think with a lot of people, this thing often happens as a spur of the moment thing. Nobody is really like prepared when it happens, or when it happens, emotions are high and nobody's really thinking, which is
Yeah.
important. Which is why it's so important to actually prepare yourself ahead of time. So to kind of anticipate these things. It's okay, I'm going on a date night. These are the likely outcomes,
Okay.
you know. So I think in today's day and age, we're all adults, and I think we all know what goes on between I won't say a man and a woman, but in couples.
Yeah.
Um,
I get you.
so yeah. Um, so it's important, one, to be realistic with ourselves and with the next person, and always be prepared. And this doesn't go just for the ladies; it goes for the guys as well, because we tend to put this responsibility of of protection or safe sex on the woman most of the time.
Yeah.
So I'd like to emphasize that safe sex is the responsibility of both partners, both people engaged in this thing. Okay. So when we say safe sex, we normally speak about dual protection. So when we say dual protection, we're talking about the condom, firstly, and that in most instances should definitely be the guy's responsibility to have a condom ready anywhere at any point. And then secondly, the contraception, which is normally from the woman's side. So I think these things are quite taboo. We don't even have conversations about them
Yeah.
as people,
True.
you know.
Yeah.
But it's quite important to Guti. We check in on each other as friends. What's, hey girl, are you on contraception? Because at the end of the day, we can pretend like these things are not happening, but they're happening. And we're seeing a lot of unintended pregnancies happening, which is quite sad because there are methods out there to prevent this from happening, and it's happening amongst our little children as well, our teenagers.
Yes.
So it's quite sad. So yeah, I think we just need to be mindful of protecting ourselves from getting into situations that we don't want to. Yeah.
Thank you for that. Loud and clear. Right, so Valentine's Day is upon us, the 14th of February, and I know everyone is partnered up. So you touched on unintended pregnancies. Now I want us to talk more about that. How can we avoid unintended Valentine's babies?
So I mean, look, if it's your first dates with this guy on Valentine's Day, I would say abstinence is the first like golden rule.
Amen.
So yeah, definitely. You know the old school rule of no sex before marriage. I
Yeah,
think that's just like the ultimate. But I mean, if you're choosing not to be abstinent for some or other reason, then again, get informed, get education about what are the options out there, to protect
yeah,
yourself.
yeah.
And this is why we've made contraceptive methods. There are just so many out there,
Mm-hmm.
and unfortunately, most of them are aimed at the women, like I've said. So it lies on the woman most of the time to actually be on a contraception or a contraceptive method. But there's quite a few. There's hormonal, and there's structural. So you could, for example, get the injection, which can be 3 monthly or 6 monthly. You could decide to get the patch, which is just simply a patch that you place here that you change every
Okay,
week. There's
okay,
also now the implant, which you like implant just underneath the skin, and that one actually
okay.
lasts quite long. It lasts about 3 months. So it's also quite a nice one because it's not so invasive. It's just underneath the skin. If you need to remove it, you can just remove
Oh,
it, you know.
okay.
But it lasts quite a significant time. 3 months. Sorry, not 3 months. 3 years is
Three
quite it's
years.
quite a
Okay.
yes, quite a significant time. And then there's also the intrauterine device. So
Mm-hmm.
this is like it's a very, very small device, and it's put into the uterus of the woman. Okay.
Okay.
Um, and some women don't like this because then they get a change of their periods and their cycle, etc. So there are there's side effects to all of these things, essentially.
Yeah,
For some of them
absolutely.
it's weight gain, for some of them it's mood swings, for some people it's changes in appetite, some
Mm-hmm.
changes in their menstrual cycle. So it just depends on what kind of side effect you're willing to deal with, or
Mm-hmm.
that's least of a worry for you. Then that's how you can sort of make your decision or tailor your decision. Also, how long you want to stay with this thing without having to go back to see a doctor or go to the clinic again. But like, really, guys, it's so important that we really go out there and just like equip ourselves, honestly, not
Mm-hmm.
even for your partner, but just for yourself.
Yeah,
And then
yeah.
again, another thing that we don't talk about is emergency contraception. So this is like if you're like in an emergency and, well, okay, it happened last night, but you definitely know that you are not wanting to have a baby anytime soon.
Mm-hmm.
There is the emergency contraceptive pill, which you have to take within 72 hours after you have had sex. So you can find it at most pharmacies where you pay for it. I'm not sure about public clinics, but I definitely know they should have it. But I think a lot of people wouldn't go there out of fear of judgment
Yeah.
or, all of those
Yes.
things.
Mm.
Yeah. So really these are things that are available, and there's really no reason for unintended pregnancies to be happening except for people to just take responsibility. If you've been irresponsible in the act of sex, just be responsible afterwards, at least,
Mm.
because there are methods out there. Yeah.
Mm. Thank you. That was very informative. So now let's talk about for some reason, let's say isiyenzekile that incident where you guys engage
Mm.
and you didn't use a condom, and actually upartner wakho uthola ukuthi unama STIs that maybe you did not know about. So how would I know if I've contracted STI? What are the signs to look out for?
Mm. So the thing about STIs is that sometimes you may not know that you have it, or sometimes you're probably just ignoring the symptoms, thinking it's something that will go
Mm.
away, right? But the thing is that we all need to actually be aware because, like I said, sex should be consensual, and consent informs being informed. So you need to be informed all the time of your own body. Would say, okay, I'm free of any STIs or anything that may possibly infect the next person.
Mm-hmm.
So normally for men and women, we say that the most common symptoms would be burning urine. So if you're going to the bathroom to pee and you feel a burning sensation, or you feel that you need to go more frequently to the bathroom.
Okay.
In men, they may also have what's called it drop, by busy drop, which is actually just a discharge, a penile discharge. Yeah, that kind of drops from the penis. Yeah. They may also have some sores or ulcers around the genital area. They may also have pain around the pelvis. And like I said, they may have a burning pain with urination. So with women, similar symptoms, needing to go to the bathroom often, burning urine, or an itchiness around the genitalia. There's also this foul smelling discharge. Sometimes it looks like this cottage cheese or feta cheese consistency. So it's a very abnormal sort of discharge, and sometimes it smells very foul. Even when your urine starts changing odor, then it's a cause for worry, you know. And then again, having to go to the bathroom frequently, and blisters and sores around the vagina. So these are all things that will point to the fact that there's something going on. Yeah.
So do you suggest that you immediately go to, to the clinic or to
Yes,
your doctor for more checkups?
definitely.
Okay, wow,
Definitely, yeah.
that's absolutely insightful. Thank you, Dr. Denis. So it's impossible, obviously, to talk about, sex education without even mentioning HIV. So, and the risk thereof. So, is there any way one can protect themselves from contracting HIV in the case that they are not certain of a risk of having been exposed to HIV and AIDS with that particular person they're having sex with?
Yeah, so like with HIV and AIDS, really we've made such great advancements and discoveries. It's really incredible. Like really, there should be no excuse to why someone is contracting HIV and AIDS, except again on our part irresponsibility. So so for prevention of HIV, or let's say you've already slept with this person, but then afterwards you find out they're HIV positive, or you're not sure, but something is making you suspicious, then there's something called post-exposure prophylaxis. Okay, so it's after the exposure,
Okay.
and it should again be taken within the 72 hours after the sexual encounter, where you will get one tablet. It's an ARV or a combination of ARVs, and that will really just help to prevent you from contracting the virus. This is the same thing that we give even to rape victims,
Okay.
yeah, who obviously where you don't know that whether the person is HIV positive or not. Then there's something called pre-exposure prophylaxis. So we've even made it possible for people who have not yet had sex with this person who's HIV positive, but may know that, oh, okay, maybe they're a sex worker, and they know that, okay, some of these people will definitely be HIV positive, some of them may be dishonest, or maybe you have a positive HIV, a positive partner who's HIV positive, and you know that they are likely to refuse to use protection now and again, or something like this. Or for some other reason, you just know that you're going to have an encounter, but we usually use it for high risk patients, so patients that will definitely in some way or another encounter having sex with a person who's HIV positive. So that is what's called pre-exposure prophylaxis. Again, it's a tablet that is a mixture of ARVs, and you take it for at least 7 days for it to be effective, for before it can be effective. And that also is said to prevent you from actually contracting the virus. So there's really been a lot of advancements in terms of HIV. There's really no excuse, honestly, on our part. Excuse me.
Bless you.
Thank you.
Right. So can you touch base Jay, on ama side effects? Kule pill kade ukhuluma ngayo.
Which one?
The very last one you mentioned.
the pre-exposure prophylaxis.
Exactly
So
that.
as with it's similar symptoms to the actual ARVs
Okay.
themselves.
Okay.
Yeah, because these tablets are formulated from mixture or combination of ARVs. So different ARVs have different side effects depending
Okay.
on how they work in the body. But most of the time, people will experience nausea, vomiting. They may have an upset stomach. Some may even have diarrhea, which is why a lot of time people just feel like stopping because it's just like, "Ugh,
Mm,
these pills are making me feel sick." But it's very
mm,
important to really, luckily with the one that you take after the sexual encounter, it's a once-off tablet, so that's
okay.
fine. But the
Mm,
one that you take before you have the sexual encounter, you have to take for at least 7 days. And I think you continue for a number of 21 to 42 days.
mm,
But you can stop at any point if you think the risk is now over, you know. But
okay.
at least a minimum of 7 days for it to be effective. So so with that one again, it's the same symptoms: nausea, vomiting, diarrhea, upset stomach. Some people can have skin reactions
Ooh.
towards them, changes of taste in the mouth,
Mm,
and sensations like that. So, yeah, some people can also develop like um, um, fat deposits in various parts of the body because
mm,
of that. But it all depends on how long you're taking these things, and obviously everyone is unique and individual, so it's
mm.
not all the same for everyone. However, the importance is just that you continue until you are protected. Like just push through the side effects. Yeah.
I know siyafunda la, siyafunda big time. Dr. Dineo, thank you so, so much for your time. But before I let you go, I want us to talk about your content, ne? I went over
Okay.
your videos this morning. I'm like, geez, like where have I been? Like your content is so informative, so refreshing. I want to know this. What's the
Hmm.
inspiration behind making a video? Like before you even make it, what inspires you to do it? How do you come up with topics?
Okay.
Like, my
so
goodness.
so the latest series, Did You Know, is quite a new one.
And
It's
I love
something I
it.
started actually this year. But really, it's just inspired by. I think it was inspired first of all by my fact that I just want to be sort of established as someone who's well known in the health and wellness industry. So initially, it was supposed to be around wellness topics, so healthy eating, weight loss, exercise, etc. But obviously, when I think about health, it's quite a whole rounded effect. So
Mm,
my content obviously touches on a lot of aspects about health. So not
yeah.
just health as just disease, but also health in terms of food or maybe, whatever
Yeah.
interesting. So the idea is just to raise awareness about interesting things or maybe topics that people already talk about, but they struggle about, so they don't know what the answers are
Mm.
or, you know. Um, yeah, so the idea is just to create just a short form video that says, Did you know A, B, C, and
Ah,
D, provides the answer
I
or
love
provides more
it.
information. And it's really just whatever I come across or whatever I have in mind, I just
Yeah.
like put it out there to say, okay, did you know about this? Or whatever topic I feel like, hey, this is a pertinent issue, I just need to put it out
Mm,
there. But I'm really loving it. I
okay.
think it's
Yep.
it's coming about to be something I was like, oh, okay, people are actually enjoying this. So I really am enjoying also doing it because it's quite
Uh,
an area that I'm passionate about, both the content creation but also the health aspect. And I
mm.
love also that it's quick. I can just do a video, although I'll probably do 10 shots, but I know it's like a 1 minute at max video.
Trust me, I can relate.
I know that at maximum it's going to be 10 shots of a 1 to 2 minute video,
Jeez.
which is quite nice. Creating the content is quite time consuming because obviously I have to write the content, practice the scripts, etc. But it's also enlightening to me because some things are also like, oh, okay, I didn't know
Uh,
that.
uh,
So I'm loving it. I'm really enjoying it. But it's new. I'm hoping to stay consistent and see where it goes. Yeah.
I hope you stay consistent because you are definitely serving your purpose. We are loving it. We find a net dictionary, it's an encyclopedia. It's when we need to know something, we head straight to content here. So keep going, Queen.
Thank you so much. Thank you so much.
You're welcome. How do we get in touch with you? How do we connect with you? Someone might want to extend on this and hear more. Sikuthola kanjani?
So obviously, on this platform, you can catch me on my page at the gifted underscore dr doctor. Throw me a DM or comment on one of my videos. You'll definitely get my attention. But if someone wants to get in touch personally as well, I am always open to that. So my WhatsApp, my personal WhatsApp is always open. At 073 637 1627. Hopefully it will be around a health topic or question.
Fingers
Uh,
crossed. I'm about to say.
but yeah, Instagram is the platform where you'll find me most of the time. So definitely, I always check my TMs, or so I'll definitely respond to those. But yeah,
Thank you so much. I appreciate your time, the information you've just given us. What I do love about the internet is that we can save this, and
yeah,
masses can still watch
can
this.
still see it.
So
Yeah,
yeah, so it has so much impact. Nje. Ngiyabonga, ngiyabonga.
thank you so much for having me.
You're most welcome. Now go back to work.
Have a good day.
You too. Thank you,
Bye.
Doc. Okay, bye. Guys, that was Dr. Dineo. My goodness, information overload. She is that good. What I need you to do right about now is follow her page at The Gifted Doctor. Her content is so informative, it's so refreshing. I absolutely love it. If you missed this one, that's okay. I'm going to save it on my IGTV. It'll also be uploaded on my YouTube channel. My YouTube channel is Miss B. Right? Don't forget to subscribe. Have an amazing day further. God bless you. Remember to do your best, and God will do the rest. Bye for now.